often patients can have multiple symptoms. So I like to ask them, what symptoms of MS are bothering you, and please rank order them, because I think it's valuable to see what the patient feels is the most important to them. But then you have to look at that list intelligently, and you may decide that a symptom that was ranked as number 3 may actually be critically important to focus on first. For example, depression, which is a poisonous symptom, can interfere with a person feeling that they can carry out things and improve themselves. So maybe I might choose that that's the most important thing to work on first. And then I think I get a game plan for every individual symptom. And the approach to treating a symptom is not simply writing a prescription, writing a drug, that may be part of it, but it may be lifestyle changes. It may be rehabilitation. It may be using assistive devices. It may be, in unusual cases, surgical or stimulation techniques. I think you really have to have an organized game plan to go after each of those symptoms in turn to try to make them as well as possible. And you can help every single MS patient. You may not be able to take a symptom away entirely, but you can improve it. Pat, how do you approach symptom management in MS?
I think it's very important to listen to our patients, listen to what they're complaining of, ask them to give you examples, perhaps if they are complaining of fatigue, ask them to give examples of what tasks they can complete. Are they having cognitive difficulties? Are they having missing deadlines at work? Oftentimes when I'm speaking to my patients about fatigue, and if they also have depression and cognitive difficulties, I oftentimes describe it as a tangled ball of yarn, where fatigue and depression and cognition all get caught up with one another. And it's sometimes hard to unravel where one begins and the other one ends, because they are so closely related. And oftentimes, if you can treat one, you can in turn treat the other symptoms as well. I think it's also important to validate their concerns and then work as a partner with them to come up with some viable alternatives. Listening or assessing for nonverbal clues are also important. The way a patient walks into an exam room, speaking to them concisely but in non-medical language, not using medical jargon, so it is understandable to the patient. So you really do develop a partnership or relationship with your patients. I think that's critically important. Tom, what do you think about that?
What we know about, for example, psychotherapy research is that there are really good techniques for helping people broadly in the cognitive behavioral domain. Cognitive reframing, acceptance and commitment, these are really important things. Mindfulness training is very useful, but one of the most important things is, in fact, maybe more important than anything else, is the relationship between provider and patient. I think the other things that can help patients are meditation, physical activity, whatever you can possibly do, cognitive challenge, and support groups with other people. Those can be hard to get up and running and hard to keep running, but when you're with other people who support your own lived experience, right? That can be very, very enhancing.
So Lillian, perhaps you can share with us how you've managed some of these symptoms that you experience and still maintain an adequate or good quality of life.
I think it's critical for MS patients to practice and be very intentional about establishing a quality of life, because we suffer so much from depression, from fatigue, and from cognitive dysfunction, and that all impacts, like Pat said, a ball of yarn, and it's so hard to tease everything out. So I think it's critical for MS patients to practice self-care, and that includes really being intentional about it.